Good day, I am Lieutenant Manjani. We are here at Dental Thaba Tswane. Today we are going to talk about all things oral health. I am here with Captain Ntuli, oral hygienist by profession. Captain, the theme for this month is Be Proud of Your Mouth. Can you please tell us more about this thing?
Okay, most people, they are unaware of what is happening in their mouth. We tend to compare ourselves to our peers or our colleagues or our friends with the type of mouth they are having. By looking at me, you would think that my teeth are more whiter than yours. That is what they're trying to say, to be proud of your mouth. In the actual fact, you'll find that my teeth color is not as white as yours. It's just the perception that you are having because you are not aware of the colors, because you are not informed of dental. So that is why people tend to feel that that other member has much more better teeth than mine. And being proud of your mouth is taking care of your mouth. It's coming in for oral hygiene cleaning twice a year and doing your normal regular checkups, check if there's any cavities. You do this twice a year. That is what we are trying to say by saying being proud of your mouth.
Besides beautiful smile that the oral health hygienist is giving, is there any education that you can give to the women and patients in general in terms of heart disease, adverse pregnancy, outcomes, and diabetes?
Okay, when women are pregnant, they need to have their teeth cleaned quite often, twice a year. They have to do this. The reason why this is done, it's related to the childbirth. When you start to have gum disease while you are pregnant, that gum disease might cause a sort of a problem for a woman while they're giving birth. A woman can give birth to a child that has a low bed weight. Low bed weight meaning the child might not come out complete. The child might have some sort of medical issues because of the kind of diseases that we got from the mouth. That is why we advise women to come in to have the teeth cleaned. Preferably you do the cleaning that's just after 3 months, because we cannot do a scaling for a woman that is between the first and the third month. So just after 3 months of your pregnancy, that's when you're allowed to do your cleaning. And then also just towards the end of your 7th month, going to your 8th month, that will be the advisable time to have your teeth cleaned. As for diabetes and high blood pressure are so related to the disease that we found in the mouth. Because there's so many bacteria that we are consuming in our mouth, the food that we leave over our mouth and we're not taking it out, it becomes rotten, therefore causing problems in the mouth, causing those bacteria. Those bacteria, as we are eating, it goes down into our system, into our heart, and it causes problem. When our heart has clots or has cholesterol, which is caused by the bacteria that we've been eating all along, what it does is it blocks those blood vessels and it makes it very narrow. So within the heart works too extra or too hard to try to get the blood circulating around the body. As a result, it raises the blood pressure. That is why you find young people as young as 20 to 19 having high blood pressure. Why? It's because of those kind of diseases that are found in the mouth. It starts off with bleeding gums. Once you have bleeding gums more than 3 to 4 months and you've tried to heal yourself, you've tried to brush, you've tried to use a mouthwash without coming to an oral hygienist, that bleeding gum is not going to go away. It's going to cause more problem for your health and for your heart, causing your pressure to rise. That is why it is related to the heart and the diabetes, because diabetes and high blood pressure are siblings. They go in hand. Immediately when you start to have high blood pressure because of the bacteria that you are having in your mouth and you're not removing, diabetes also follows because they go as a sibling. So that is why people should be aware of those kind of things.
What is your department doing in combating the prevalence of the gum disease? Estimated 90% of South Africans experiencing the problem at some point.
Okay, our department, we go out to the units. We have a project that we do. We do it every 2nd month. We choose units. Each oral hygienist is given almost about 20 units to look after. Where we go to the units, we do education. We bring the patients to us because there are many patients in the Defence Force who have never been to dental at all. They are working there, they are comfortable working there, yet they are sitting with problems of bleeding gums. And most of our patients are not aware of bleeding gums. They are thinking, no, I'm probably hurt myself, I've burnt myself. They are not aware, they don't even know how to get help. So therefore what we do is, as our department, we go into our units and we start doing our education, we start doing our CHARs, we do our checkups in those units, and we see if there's any problems that the patient needs, and we do an intervention. While we go there, we take our diaries with, and we make sure we give those patients appointments, we give them education. There's many other problems that those patients are also having regardless of bleeding gums. There are patients who are doing smoking, there are patients that are grinding, there are patients that are having a whole lot of problems in there. So we go in there, we do those education, we do our education before we even start with our checkups. We sit them down in a group and give them education. If we see there's a need to come back to the units and we see there's a lot of work to be done in these units, we redo the units where we go back again and we do education and make our patient aware that this is what is bleeding gum and this is how it's going to be stopped.
So, what I can find in your mouth right now is a food that is stuck in your wisdom teeth. Mm-hmm. We have 4 wisdom teeth which we don't use. The reason why food collects there at the back is that the toothbrush cannot reach right deep down there at the back. This is why we advise that we remove our wisdom teeth. So what happens is when we eat our food gets stuck there and you are unable to take it, eventually it makes the teeth in front rotten. Now, the reason why we have bleeding gums in our mouth is that we leave food for long. There are cases where people leave food for 1 year, 2 years, 5 years. They just left it in the mouth because they're not aware that it's a problem. So food accumulates underneath the gums, causes your gums to bleed. Immediately when your gums bleed, it means that there's food stuck there for a long time. So your body is trying to fight the infection by telling you, listen, there's a problem here. But we tend to ignore that because it's the mouth. So the only way to prevent food from staying underneath the teeth is doing flossing, and every day.
Please tell us when and where can people go do their dental checkups?
Okay, we have quite a few clinics around Gauteng. We have clinics at Vonderbom, we have clinic at Armsco, we have clinic at Waterkloof, we have clinic in Thaba Tswane. Thaba Tswane is currently the biggest clinic here in Gauteng, which has about 24 dentists and about 4 oral hygienists. So this is the bigger clinic where we refer all our patients in here. So patients, when they need cleanings to be done, they can either go to the closest sick base. If they're in around the Waterkloof areas, they can be seen that side. If they're in Vonderbom, they can be seen in Vonderbom or Armsco. But most of the patients for all over Gauteng, they come to this big clinic, which is Thaba Tswane.
This is your last question, Captain. What advice can you give the community besides daily routine dental care?
Okay, community needs to be informed about the oral health. Community needs to know that immediately when you see bleeding gums, your gums does not mean now you have cut yourself, you have hurt yourself. Immediately when your gums bleed, you come forward, you make an appointment with the dental oral hygienist, you come through. The community also is not aware that there is a dentist and an oral hygienist. As soon as they see the white coat, they think we are doing the same kind of a job. Maybe they should be informed with, okay, this is a dentist, and this is what the dentist does, and this is what the oral hygienist does. And oral hygienist, what we do, we specialize in education. We specialize in awareness. We specialize in gum care. While the dentist does is, they do more of prevention. So when the patient comes in, they have no problem whatsoever. They just want to do a checkup. The first thing that they need to do is to see an oral hygienist. That's where the oral hygienist will do a checkup, do the cleanings, and give the patient information to say, okay, we see here you have a filling that needs to be done. You need to see a dentist. Then we refer to a dentist. They need to be able to come in twice a year for the kids, for the whole family, to have the teeth checked by an oral hygienist, therefore referred to a dentist.
Thank you, Captain, for giving us so much knowledge today regarding oral health. I am Lieutenant Manjani, reporting live at Dental Thaba Tswane. Thank you.
Health Warriors, serving the brave.